Welcome to the River City Hardball podcast. I'm your host, Andrew Gibson, and it's the place to talk baseball here in Jacksonville. I want to bring on my friend, Dr. Jacob Evanich from Optimized Physical Therapy and Sports Performance. Dr. Evanich, thanks so much for joining us. I want to talk specifically tonight about Tyler Glasnow and his injury. But first of all, how you been doing?
Good, man. Yeah, thank you for having me on, Andrew. I really appreciate it. And yeah, it's been fun just getting after it with some of the baseball and softball players over at DBATS and some strength and conditioning, some physical therapy work. And yeah, just really trying to optimize the performance of Jacksonville baseball and softball.
If you guys aren't familiar with what Dr. Evanich does, Doc, tell us about what you guys do, your practice, and what you do in partnership with DBAT.
Yeah, so my company is Optimized Physical Therapy and Sports Performance, and we ended up partnering with DBAT Jacksonville to help provide physical therapy and sports performance services within their facility. So they already had obviously the hitting and skill training, and they were looking to kind of expand and make sure they could get everything under one roof in one facility. So I partnered with them to help get the sports performance and physical therapy side for baseball, softball players that are having some pain and injury, and also just to kind of optimize performance and improve their strength and power to really perform on the field also.
It's a great service for sure for local athletes, whether it be baseball or softball here in the Jacksonville area. So definitely check them out. We'll get into that a little bit more, but I want to talk specifically tonight about Tyler Glasnow, the Rays pitcher. Last week, in part, blamed the Major League Baseball's crackdown on the use of foreign substances. He was using sunscreen and I guess maybe a little bit of rosin, but his particular substance was sunscreen to rub on whatever, his glove, his arm, and to try to use that to be able to pitch. And his, thing that he said about it, Jacob, was he used it for grip. And now all of a sudden he's got a UCL injury. What was your total thought on all this with Glasnow?
Yeah, I know there was a lot of kind of uproar where is he making excuses to, people were thinking, or is this legitimate? But when I thought about it right away, I was like, man, I didn't think – I forgot that they were going to be locking down in the next week or so guys were going to be weaning off of it. So it took me by surprise that he was talking about it already. But when he did, and I got to thinking about it, I'm like, man, it makes sense. And I hope this doesn't happen to a lot of other guys. But when you're throwing as hard as he is throwing, and the pitching movement is the highest recorded velocity movement that a human moves at. When you combine that with how hard he's throwing, it makes some sense. So I was thinking I would go into a little bit of some of the things that kind of played into his case, because he ended up having a partial UCL ligament strain or sprain, and then he also had the flexor strain of the muscles in the area. So what does that kind of mean? The ligament itself is more of just a band that keeps, when you throw, you get a lot of valgus, what we call valgus torque on the elbow. We need a couple things to make sure that the UCL isn't the only thing working to keep the elbow together throughout the throwing motion. Because when we're throwing, if we didn't have any other structures to help out the elbow, the UCL would actually tear every time, which a lot of people don't know. It's just not strong enough to tolerate that velocity that we're and the forces that we're putting through it. So we need muscle strength. The muscle needs to help. You have a capsule around the joint itself also, which is also kind of like a ligament. It's kind of a passive structure. And then we also have bony restraints. So the bone actually helps keep it together as well. What he was talking about was he had to change his grip a little bit. He had to grip a little bit tighter. And he was saying that was the main complaint, to try to increase his spin or keep his spin rate up, along with making sure he's controlling his pitches. So I believe that, yes, his complaints are valid, because if maybe he had to throw a little bit different too. So changing your mechanics can change kind of the way the force is going through the elbow. I think the biggest thing that it sounds like happened with him, because he had the flexor strain. So flexion is when you kind of bring your wrist towards you. And if anybody's watching the video, I'll kind of show. But when you're bringing your wrists and your hands towards you, Those muscles attach right where the UCL is as well. So he had a strain of that. If he was gripping the ball really hard, he had to use those muscles in that area. So they could have fatigued throughout, with how many pitches he had to throw, and then he could have a strain result. Once those muscles get really tired, then they can't help with the actual UCL ligament, and that's when a strain possibly could have happened.
He was talking about, like you said, his tighter grip on the baseball. And to me, that would seem to lead to, putting extra compensation for other things to go wrong, right?
Yeah, absolutely. So pitching is a full body movement, as we know. So you're basically generating the force from the ground, starts at your feet, goes through your legs, through your hips, through your trunk and stomach, through your shoulders, and then finally out through your hand into the baseball. And that's how we generate the velocity. So if you're kind of changing anything in that sequence, it can definitely change how the force is going through that elbow and increase the injury risk. Some of the other things too that can kind of lead to the injury risk. So we already talked about the muscle weakness. If there's weakness, specifically in his case, we're kind of focusing a little bit more on the elbow, but it can, like you were saying, it can be weakness anywhere along that chain. So if you're having weakness even in your ankle and foot, it can throw things off. If you're having weakness in your hips, it can throw things off. So we need to make sure we're staying strong. With him, he could have fatigued throughout the start a little bit more than he usually does, increasing his injury risk. If you have decreased range of motion too, so especially in your shoulder, that can increase injury risk. If we have a little bit more of the capsule laxity in the area, so like I was talking about that tissue that goes around the elbow to really keep everything taut, that, like, your muscles can kind of stretch and then they go back to the same form that they were. The capsule over time, and it can be normal for pitchers, especially in their shoulder, it can just loosen a little bit. It's almost like a paper bag. So you start kind of gradually stretching. It doesn't really conform back to the way it was previously. So that can increase a little bit of our injury risk. And then the other thing is changing your mechanics. So those are four of the big things that really play into that. And with him, we're thinking it could have been two of those four leading to his injury.
So Tyler Glasnow is now going to choose the route of rest, rehab, and elect to not go through a procedure at this point. What do you think about that route, and how does that look for him?
Yeah, so it's interesting. So they definitely take a lot of, well, we know the pros have a full team of people trying to decide what to do in this situation. So in his case, it sounds like he must have not had a full tear of that UCL ligament. If you have a full tear, you're going to have surgery. There's no repairing it unless you have the surgery. So in his case, he must have had a partial tear, so just a little bit of tearing of that ligament. With that being said, it depends on where the actual tear is also. So if it's a little bit lower down towards your wrist, that decreases your likelihood of having a recovery. So your likelihood of having a surgery in the long run is higher. If the actual injury is a little bit higher towards the elbow, that improves your actual outlook of recovery without having surgery. So potentially he had his a little bit higher. So those are some of the things they probably looked at. With the rehab process also, if he can stay away from surgery, he'll definitely want to do that, because they say maybe a lot of times the general guideline is like a year out to start really throwing. What they found though is a lot of guys, it's more like 14 to 18 months. I mean, you can even look at Chris Sale. I mean, when's the last time he's pitched? It's been a long time since he had his Tommy John surgery. So he's going to probably be more at that 18-month timeline. And they're just starting to not really rush these guys back, because you need that actual, if you have the reconstruction, you need that the muscle that they end up putting in there in place of the ligament. So they take a piece of your, not to go too far into it, but they take a piece of either your hamstring or another muscle that's in your leg, or one of the muscles that's in your forearm, to take place of where that the former UCL ligament was. And it takes time for that muscle to end up actually turning into a ligament again. So that's why it takes so long. In his case, we're looking at about, if I'm thinking correctly, about 4 or 5 months is what they're trying to get him back in for the playoffs. So it's a lot less of a rehab timeline. So hopefully it all works out for him, and he can get back in that time, because he's a heck of a pitcher and he's fun to watch. and we need our Rays to do good.
Yeah. Well, he's having a Cy Young caliber year in the American League as one of the top pitchers for sure, Tyler
Yes.
Glasnow of Tampa Bay. So, with a partial tear of the UCL, and if you go to the route that he's going, the rest and rehab, electing not to do surgery, are you in a sense delaying the inevitable that you will have to have surgery eventually, or is that not necessarily the case?
That's definitely not the case. So if he's kind of following some of those points that I talked about, having the minimal tear, having the tear in a certain spot that heals a little bit better, then a lot of the, if you follow a certain criteria, 70 to 80% of those guys are able to return to throwing at their previous level without having to have the surgery. So it actually is, it's relatively new to track these guys and see who fits perfectly into the categories. But from what they've been doing so far, they find about 70 to 80%.
That's interesting. I know our topic is Tyler Glasnow. There's another guy, real quick. I just want to mention this. So Zach Gallen, who pitched for the Marlins, and he was, I think, originally drafted by the Cardinals. Anyway, he had a similar injury where he had a partial, I believe it was a strain or a tear, and he was out for maybe a month or so, maybe a little bit longer, and now he's back. And I think the prevailing thought was that, well, he'll have to go underneath the knife and have to miss a year plus, but he's back. I mean, and some have said that they might have rushed him back a little bit sooner than you would have expected, but he's back and he's made 2 starts now, and I think with no problem. So with the route of going to rest and rehab like Glasnow's doing, what are
Mm-hmm.
some of the rehab techniques? What are some things that he's going to be doing right now to get himself ready in the next few months?
Yeah, so first and foremost, since he had the strain of the flexor muscles of the wrist and fingers, they're going to have to get that to calm down. So they'll do anything they can with that. So you will do some exercises, some stretching. They will do some light strengthening, stuff that doesn't flare that back up, because we don't want to keep it flared up, so we can decrease the rehab timeline as much as possible. Along with that, if there is any areas that are lacking range of motion, they'll definitely focus on those. Some of the big things in the shoulder, which I'm sure he doesn't have these issues, but just for some of the listeners to hear some of this. If you don't have full external rotation, so kind of when you torque your arm back for the throwing motion, that increases your injury risk about 2.5% if you don't have full external rotation. Some guys after their starts, they lack a little bit of that, so they use their arm care and other exercises to make sure they get all that back before their next appearance. We call it total arc of motion, but the combination of external rotation where we're torquing back and also internal rotation where we're kind of bringing our wrist and hand forward, you need that to be about 180 degrees. If you're lacking 5 degrees or more, they've also found a 2.5 time increase in injury risk. And also if with the shoulder flexion, where I think keeping your arm straight and just raising it straight up overhead, if I was to take you, Andrew, and I was laying you down and I was taking your shoulder and just doing it myself and you weren't doing any of the work, if you're lacking some of that range of motion when I do that with you, it's showing you're definitely having some tightness in the muscles and other structures of the shoulder. That increases your injury risk also about 2.8%, or 2.8 times. So they'll end up making sure all that is perfect. They'll make sure to gradually first decrease any of the pain, inflammation, and let the tissues heal up. And then at that point, it's just a lot of rehab to gradually strengthen everything in a way to eventually get them back to throwing. Also, we're focusing, as always, it's easy just to focus on the shoulder and the elbow, but it's a full body thing. So they'll be working a lot of core work, especially. That's really big. So he'll be working his full body as well to really be ready to fully pitch. And then once you get to the point where it's time to throw, then you can't just go full tilt back into it. He's going to be on a little bit of a throwing program to gradually ramp things up. And when he comes back, I wouldn't be surprised if he's not necessarily starting the games. Maybe he'll come in for a couple innings, 25, 30 pitches if it's still kind of early in his rehab process, depending. But if he's done really good with that rehab process, maybe he will be ready to get a start.
So Glasnow is now going to have to adjust to the fact that he's not able to use sunscreen anymore. So that was part of his issue with it, is that, okay, I've been using this forever. Now all of a sudden Major League Baseball is going to enforce this rule in the middle of a season to have to adjust to something so quickly. obviously that's part of why he tore partially his UCL and had the flexor strain. So how do you adapt to that? What would you advise him as far as like preventative measures going forward to try to adjust to that?
Yeah, well, hopefully he watched Scherzer the other night, so he can see that maybe hopefully he sweats a lot and he can put his hand through his hair and use that with the rosin, and
Right.
maybe he'll be good. Try to find another means that way. But no, it's definitely going to take some adaptation. So hopefully he can just kind of work on some of that grip while he's doing his rehab processes. And yeah, I'm sure he'll just keep trying to, I guess, experiment with some things. Maybe we'll try to, honestly, just like the sweat and the rosin and see if that'll do it for him. But yeah, he definitely is going to have to some of the other guys obviously have been able to do it okay so far. He's just going to have to find a way to decrease that over gripping the ball and kind of trust his stuff.
You know, it is interesting. He mentioned when he was interviewed and went on that big rant that we've all seen by now, that he did go without it for a start against the Nationals, and he performed well. He struck out 11, but then he said the next morning he woke up and he felt shooting pains that he'd never felt before. That's where you really have to try to adjust to whatever's going on.
Yeah, absolutely.
You know, so we're talking about Tyler Glasnow. Hopefully, for his sake, he's able to come back strong and perform at the level that he once did. You know, for him, a guy that throws so hard, he throws 100 miles an hour, and a lot of guys do. Are you surprised that more guys nowadays, you know, don't already have Tommy John surgery because of the velocities that we're seeing?
Well, luckily, with the increase in velocity has come some advances with us understanding some of those risk factors for injury. So if we're stronger, these guys are on a lot better strength and conditioning program. So that's allowing them to throw a lot harder and let the muscles dissipate some of that force also. Mechanics, we have so much stuff now where we can really track mechanics really well, especially for those pro guys. They have everything available to them. So you can really make sure, you know, you're getting some of those biomechanic images to make sure that you're throwing in a way that's not increasing major stress on that UCL. So I think it's pretty awesome the way that we've been able to maximize all that stuff in the last number of years. We're definitely still learning, but at the same time, that is one of the risk factors for UCL injury is if you have increased velocity that you're throwing. I have a couple others here. So it's kind of like the 8 main things we look at to increase injury risk of the UCL. So one thing is the increased velocity, like we were talking about. And just for fun, we'll kind of compare this to Glasnow and some of these other pitchers who are throwing major velocity, like DeGrom and everything. High pitch counts. So starters throwing that hard, a little bit increased injury risk. We're constantly putting those forces through the elbow and the UCL. Pitching more than 100 innings a year. So that's a lot of times why nowadays we are trying to limit the pitch counts and doing a better job of that, especially high school level and everything. Because some of those guys are throwing so hard, so quick, which is awesome. But at the same time, we got to make sure they're strong enough to kind of support that. So 100 innings in a year, so starting pitcher increases your risk. Also pitching for multiple teams for guys in high school and younger, and even college, playing some of these college leagues, that's an increased injury risk. Fatigue, the muscle fatigue, so not being strong enough to, pitch consecutive pitches for multiple innings. And then pitching consecutive days, decreased total arc of motion, like we were talking about, that 180 degrees, if that's decreased. And the other thing that's kind of interesting too is actually geography, because if it's warmer climates, guys are throwing more throughout the year, and increases their injury risk because they are probably getting over their 100 innings or more.
Yeah, it's something you constantly have to manage and monitor, that's for sure. As we wrap things up, Dr. Jacob Evanich with us from Optimized Physical Therapy and Sports Performance. Tell us once again about your company and your partnership with DBAT, the services that you offer.
Yeah, so we just really saw a need in the Jacksonville area for specifically baseball and softball services for both just getting those guys stronger, being able to create more power. Like we were talking about, they're guys around here, they're so advanced with how hard they're throwing. And we just need to make sure that they're strong enough to support those things and really excel going into the future. So I saw a need for that. We also saw just in other physical therapy practices, baseball is such a skill specific sport. So it really is important to understand the sport and how specifically we need to go about the rehab process. So it's not a cookie cutter approach or one size fits all, especially with baseball and the shoulder and how complex that whole the shoulder is, the pitching motion, all that stuff is just so complex. So we saw a major need for it. We think we can kind of plug that hole in the area. And we also are making sure to help kids understand throwing programs, what they can do during the week to really structure their throwing routines instead of just going out and throwing. Really have a little bit more intent in what we're doing to really maximize and optimize our performance, and try to get guys on things like even arm care programs during the week. It's such an easy thing to overlook, but it's so important for the long-term health and performance of these guys.
Great stuff. If anybody's interested, how can they check you out?
Yeah, so you can follow, you can check us out on the website, which is optimizeptsport.com. You can always email me, jacob@optimizeptsport.com. And then you can also find us on Instagram at optimizept_sportsperform, where we'll be posting content on some of the stuff we do for people to get a better idea. And then also on Facebook, you can find us at Optimize Physical Therapy and Sports Performance as well.
Great stuff from Dr. Jacob Evanich from Optimize Physical Therapy and Sports Performance. We're going to do this every Wednesday, and I'm very much looking forward to it. Thanks so much.
Yeah, absolutely. Great being on here, Andrew, and I really appreciate it.